Thank you, Michelle. It's a real pleasure to be here with everybody tonight. Thank you for the invitation. And I just want to underline, one of the things you said, our kids love tree song. I don't know if any of you are nature school attendants or if you've ever had a nature school in your life, but tree song is certainly a huge part of our kids' lives. And I would encourage you to support your local nature school or tree song if that's your local nature school as well. There's just a few of us. Can we go around the room? And I would just like to ask each one of you what comes to mind when I say planetary health, and how do you think it relates, or in your own, what comes to mind, and then how does that relate to your life? And we can go around and people can jump in or not. What comes to mind when you hear planetary health?
Healing for the planet.
Thanks, Jane. Healing for the planet. So the other side of that coin is what? The planet needs to heal.
Yes.
Great. Any others, Jonna?
I think too much comes to mind. And I just watched a new documentary. What's the name with the boundaries? It's with the Sir Attenborough. It's his newest one. It just came out on Netflix.
David Attenborough, yeah.
Yeah. And so planetary health, I mean, the first thing that came to mind was Amazon and what we're doing down there, and how we're ruining that part of the planet, and how crucial the rainforest is to the health of the planet. And, on so many different levels, it's the deforestation, how damaging that is, how damaging agriculture is, how we are basically ruining our water supplies all over the world. It's just too much comes to mind on this subject. But
well, that's very well said. I think you could probably do this class tonight. It sounds like you have your finger very much on the pulse.
Lily did a power presentation in September on global warming. It
Really?
did traumatize her. It traumatized her, though, just having to research through. So she's a little nervous about listening to your presentation, because it scares the kids, and rightfully so. Right?
Exactly. I mean, that is extremely poignant and true, and unfortunately true. But so tonight, Lily, we're going to take a little trip. We're going to go to Indonesian Borneo. We're going to go very briefly to the Amazon in Brazil, and very briefly to Madagascar. And we're going to be visiting rainforest communities there. Now, some of the language that I'm going to use, I'm not going to use 4-letter words, but some of the language I might use, not everybody may understand it. I've had a very, very long day, so I also might not be speaking clearly. But if there's ever anything that I say that either you don't understand or you'd like to know more about, please, what I would ask you to do is just stop me, just sort of interrupt me. I may not see the yellow hand that you put up, but please interrupt me, and happy to take questions as they occur to you. And any ideas or really cool articles you have or that you would like to share with the group, please feel free to chat them. Okay. And Doug and Lori and Kathleen, I'm just going to continue, but you guys, if you want to say anything, just please jump in. All right.
Oh, I was just going to say, thanks for doing this, but when I think of planetary health, I just moved to the Seattle area, and I took up fishing as part of a new hobby of mine for during the coronavirus. And the more I've gotten into it and the more I've learned about the fish populations in this area, the more I realize how much they're in danger and how much that's completely tied to planetary health and what's happening in the Seattle area. So that's one thing that really hits close to home for me.
Okay, fantastic. That's very, very, it's very apt, and welcome. That was Doug, right?
Correct, yep.
Okay, thanks so much. And look, Lily, we're going to start out with the bad news, and we're going to come to the good news, okay? But here's how the bad news sounds. Life as we know it on planet Earth is at risk of becoming unrecognizably altered because of one species, and that's us. We're destroying the Earth's life-giving systems. So in the geological nanosecond that our species has existed, we've created a climate crisis and we've engineered the collapse of nature. Now, these twin crises, so the climate crisis and the collapse of nature, these are the greatest challenges, in my opinion, and in many others' opinions. But allow me to be a little bit bold. These twin crises are, in my opinion, the greatest challenges humanity has faced in our approximately 200,000 years of existence. Let me figure out. There we go. So you should be seeing a graph. Now, I don't want you to get lost in the confusion of this graph. I want to explain. We're going to be looking at two macro indicators of this collapse. One is greenhouse gas emission or carbon dioxide emission or global heating, which is the primary driver of the climate crisis. And the second indication is going to be vertebrate extinction or the extinction of animals. So this graph shows you the levels of carbon dioxide, CO2, okay, the levels of carbon dioxide in the atmosphere going back about 1 million years. Okay, and this graph is from the National Oceanic and Atmospheric Administration, NOAA, and the data is based on ice core data. Okay, the line on the graph shows you levels of atmospheric carbon dioxide in parts per million going back about 1 million years. Now, if you look at the last 60 years of this graph, that's approximately 1960 until today. The annual rate of the increase of atmospheric carbon dioxide over that 60 years, so the past 60 years of our lives, for any of us who have lived that long, the acceleration of atmospheric carbon dioxide is 100 times faster than previous natural increases during the Ice Age. Okay. Now, this graph very quickly, and I don't want to go into any detail here, this shows the extinction rates of large vertebrates, so large animals, going back several hundred years. And you can see that from the 1850s, 1900s, we start losing these species. They start going extinct, so they're dying off. And some of you may be aware of it's not even scientists only, but in popular media, we talk about humans are driving the 6th mass extinction. Okay, so the last mass extinction is about 65 million years ago, which includes the, one theory is a meteor or an asteroid hit Earth and drives the extinction of dinosaurs. Well, now human activity might be driving the 6th mass extinction. These spikes, they're not normal. The collapse of nature isn't normal, and this spike in atmospheric carbon dioxide isn't normal. It's happening because of human activity. And together, as I said, they're the #1 threat to human civilization and the longevity of countless species on Earth. So we have to act now. In fact, scientists overwhelmingly agree that we have until the year 2030, which is about 9 years away, plus or minus, to have atmospheric carbon dioxide, to reduce by 50% the amount of carbon dioxide emissions that we're spewing into the atmosphere. And we must be carbon neutral. Again, this is humanity, must be carbon neutral by the year 2050 in order to avoid the worst impacts of the climate crisis. Now, we know that damaging the planet damages human health. I'm just going to give you a second to take a look at this slide and sort of digest some of the topics that we're talking about when we damage the planet: the climate crisis, biodiversity loss, malnutrition, overuse of water, and then soil degradation, the erosion of our topsoils and turning lands barren, unable to produce food. Now, the impacts of the climate crisis on human health are well documented. Today, unclean air pollution, causes about 7 million deaths annually worldwide. And that's according to the United Nations World Health Organization. Today, 3 times more people are killed by pollution than by AIDS, malaria, and tuberculosis combined. And that's according to the Lancet. Prolonged drought, we know, is one of the most dangerous environmental determinants of premature death. And we know today that some 30 countries are currently experiencing downward trends in crop yields and in the nutritional quality of their crops. So not only are they harvesting less, but what they're harvesting it has a lower nutritional value. And this only gets worse as global heating continues. We also understand that people are going to move because of climate change. These people are called climate migrants. And we're expected to see 2.5 billion climate migrants, so people, moving into urban settings in the next decades. Now, when they do move into urban settings, megacities, they face continued environmental, physical, and psychological threats, as well as increased risk of violence. So as Michelle alluded to, before becoming the executive director of Health and Harmony, I spent about 15 years in leadership roles around the world with a medical humanitarian organization called Doctors Without Borders, which is often known by its French name, which is Médecins Sans Frontières, Doctors Without Borders. And I was responding to crises such as these 3 on the screen. These were 3 of the humanitarian crises, going back a decade or more that I've been involved with the response to. That's famine in the Horn of Africa, the conflict in Syria, and the Ebola outbreak in West Africa. Now, let me stop there and let me ask for anyone who might not be too shy, what links these 3 humanitarian crises? What do they have in common? Anyone? A guess? Well, I'll tell you. I'll take the pressure off.
Okay.
Well, go ahead, Michelle.
Oh, I was just going to say, I'm having a feeling that planetary health is at the core of each of them.
Global
Exactly.
warming. Yeah.
Yeah.
That's right. Exactly. These 3 crises are all driven directly or indirectly by environmental degradation and the climate crisis. So after 15 or so years with Doctors Without Borders, I got frustrated waking up every morning going to work to deal with the humanitarian fallout of a sick planet. I believe fundamentally and deeply now that our planet is the patient and its vital signs are not good. Now, I want to talk a little bit about health. Okay, when I talk about our health, what thoughts, what images does that invoke in you? What does that mean? What does health mean?
Lack of disease.
Lack of disease, good.
I think of respiratory health.
Respiratory health. Great. So the World Health Organization, which is a United Nations agency, their definition of health is a comprehensive state of physical and social and mental well-being. Now, you would say, Jonathan, that's a wonderful definition. And I would say, yes, but that definition, and I'll give it to you again, health is a comprehensive state of physical, social, and mental well-being. It implies interconnectedness to nature. Yet healthcare practice around the world for a century has focused narrowly on disease burden in one species, humans, mostly in a vacuum, neglecting our dependence on nature and the ecological determinants of our health. Meanwhile, in that same century, the life-giving ecosystems of planet Earth have all but collapsed. So in the prophetic words that are credited to Chief Sealth, or Chief Seattle, as is more commonly known, of the Duwamish tribes of the Pacific Northwest here in the US, Chief Sealth said, "Man did not weave the web of life. He is merely a strand in the web of life. Whatever he does to the web, he does to himself." And I don't think anyone could argue convincingly that we are not doing enormous damage to the web of life. And consequently, the very foundations of our societies, of our economies, of our food security, of our physical and mental well-being are eroding. So it's time to expand, in my opinion, in my humble opinion, it's time to expand how we comprehend human health. More specifically, it's time for the practice, the theory and practice of healthcare to cease to be so narrowly focused on disease burden in the individuals, populations of only one species. And it is time for the comprehension of human health to expand to encompass our interdependence with nature. It's time for this new discipline of planetary health, which emerged in 2015 as a new field of study and practice. And planetary health is defined as the health of human civilizations and the integrity of the natural ecosystems on which our health depends, right? So do you hear the interdependence absolutely baked into this? The health of human civilization and the health or the integrity of the ecosystems on which our health depends. Our species is one amongst many on the ecosystems where we live. Our health is fundamentally linked to the integrity of that ecosystem. So on which our health depends, that's a terrific distinction. And indeed, to safeguard the health of our species, we have to safeguard the health of the planet. And one of the most critical things that we can do today to improve the planet's health, to reverse the climate crisis and to reverse the collapse of nature, one of the most important things we can do is to reverse the loss of tropical rainforests. Okay, and you can see that right here. To safeguard human health, we need to maintain the health of the planet on which we depend, and ending deforestation is a critical piece of the puzzle. Now, the record high levels of atmospheric carbon dioxide, which I showed you in that very boring graph a few minutes ago, and the loss of biodiversity, which I showed you in the other very boring graph right next to it, these are both largely due to rainforest loss. The cutting and burning of forests accounts for about 78% of all land-based greenhouse gas emissions. Now, carbon dioxide is only one greenhouse gas, but it's the one that is most voluminous in the atmosphere. The cutting and burning of tropical forests accounts for 78% of all land-based greenhouse gas emissions. And of course, when you lose rainforests, what else are you losing?
Species, all the different
Exactly.
creatures. Yeah.
Exactly. You're losing massive amounts of biodiversity. And this is biodiversity we rely on. This is biodiversity that gives us life. And the most obvious sort of metaphor being most of our medicines are derived from organic chemicals found in nature. Meanwhile, we know from, by now quite famous projects like Project Drawdown, we know that one of the most effective and least expensive ways to mitigate global heating and to protect nature is to protect and expand tropical forests. Now, the majority of rainforest loss in the world is not due to commercial scale clear cutting. It's due to local community-based degradation. And this is mainly because tropical rainforest communities across the globe face grinding poverty. And this includes a lack of access to basic needs, a lack of access to basic services like healthcare, like food security. So while these rainforest people are the experts in knowing how to live in balance with local rainforest ecosystems, they are too often left with no choice but to log or mine the rainforest for access to the cash they need to make ends meet and to survive. So consequently, across the tropics, we find that Health and Harmony, we find the biggest drivers of their rainforest destruction are the costs of out-of-pocket healthcare and medical emergencies, and the lack of access to jobs other than mining or logging. Okay, so this is where Health and Harmony, my organization, comes in. Our mission is to reverse deforestation of tropical rainforests, to curb global heating, and to reverse the loss of species. And the way we do that, which we refer to as our model, it's as unique as it is simple. First, we understand that local and indigenous rainforest communities are the experts at knowing how to live in balance with rainforest ecosystems, not us. We're not the experts. So our intention is to restore agency to the rainforest people who know how best to protect rainforests. And I want to stop there for a second. And I just want to ask you guys to reflect on that statement. What we are intending to do is restore agency to these rainforest communities. What does that mean? Restoring agency to them.
Does it have
Any
to
guess?
do with?
Doug, go ahead.
Oh, sorry. Yeah. Does it have to do with giving those communities the knowledge and maybe means to help reverse these effects within their own community?
Yes, that's a big part of it. That's a big part of it. So restoring agency is restoring control over your own life, which in many, many, many cases has been taken from you, right? Either through impoverishment and sheer poverty, or through political systems that marginalize you, like is the case for indigenous tribes and indigenous communities right now in Brazil. Okay, so we want to restore agency to these people who know best how to protect the rainforest that is so valuable. And I don't know who said this earlier, but these rainforests are like lungs of the planet that are so valuable to all of us wherever we live. My health here in Portland and the health of my family is affected by the choices that these people make in their rainforests in the Brazilian Amazon, Madagascar, etc. When that forest is felled, our health suffers, regardless of where we live on the planet. Okay, so to restore agency, this is what we do. We enter rainforest communities and we practice a methodology that we call radical listening. And radical listening starts with this very simple question. We say, you are the guardians of a precious rainforest that is valuable to the health of the whole planet. How might the world community assist you to live in balance with this rainforest as a thank you for your guardianship of it? So do you hear the anti-colonial mindset there? You hear the reciprocity there? Like, we need these people to have the ability to protect these rainforests. They know how. They have hundreds of years of expertise and experience, thousands of years in some cases, of living in balance, in harmony with these ecosystems. And we desperately need them to make their wisdom and expertise known to the world, and the world needs to invest precisely in their solutions. And that's what we do. So we ask them this question, and then we listen for hours, and we document the solutions that they design to be able to stop logging and reverse deforestation, or to stop mining, which is the case in some parts of the Amazon. And then we invest precisely in their solution. This is quite unusual in the industries that I work in, the international development industry or the aid industry. It's very unusual that the person of the place, that their wisdom is respected, that their design is the guide, and that then they are invested in precisely as they see fit, precisely as they want to be. So in 2007, we entered for the first time communities in Indonesian Borneo, and they and practiced radical listening, and they concluded that they could stop logging if they had access to two things: quality, affordable healthcare, and jobs training in alternative livelihoods. In other words, all I know how to do is log. I can't not log unless I learn how to do another trade. These people had no other economic opportunity except to log and sell rainforest trees. And the critical reason was to be able to afford their healthcare and medical emergencies. The connection between their human well-being and the integrity of the rainforest was that direct. They were cutting down rainforest trees to sell them for the cash, pay for their sister and their mother's emergency cesarean section. Like, that's how direct the link is. And the connection that I've just described, this is the reality that we see in tropical rainforests from Brazil to Madagascar, across Indonesia and to the Philippines. So that's what we did. We invested precisely in their systems-oriented solution. Now, I'll draw your attention back to the slide. Our model, I said it's very simple. We're guided by communities. And we know, number two, that complex problems require complex solutions. So we are committed to investing in systems-oriented solution. Now, what is a system? It's very simple. It means that the solution is not just going to be about health. It's not just going to be about agriculture. It's not just going to be about economics. It's going to be about a melange, right? It's going to be about all of the above. And we are committed, while we're not experts in all of the above, we're committed in bringing expert resources to the solution so that communities can realize their solution and that we can reverse deforestation. So again, we did exactly what they designed. We established a 15-bed hospital for the catchment, or for the population of about 120,000 people living in the rainforest. And we initiated jobs training in alternative livelihoods, mainly in organic farming, to transition thousands of loggers into safer, better paying jobs. And there's an example of one of the articles that we've written in Salon. And you can see we just have to listen. So our whole approach, our whole anti-colonial, our whole notion of reciprocity, everything we do is based in this radical listening approach. And then the final component of our model is the transfer of global resources. Many of the communities with whom we work have been the quote unquote victims of colonial practices. Their local wealth has been stripped from them, robbed from them. It's why our country and Western Europe and other industrialized nations around the world are able to live at a level of quality of life that is much, much higher. So we're committed to executing a transfer of wealth back into these communities, but importantly, as a thank you for these communities' expertise and their ability to reverse deforestation and protect forests. So I'm going to get a little bit pointy-headed now, because I want to tell you, we are trying to take this model to scale. What does that mean? That means we want everybody using it. We want everybody doing this, from the government of Indonesia to the government of Brazil to the Nature Conservancy, World Wildlife Fund, Doctors Without Borders. We want everyone thinking the way we think about planetary health, but more specifically around the link, the intimate link, the inextricable link between human health and ecosystem integrity. So I'm saying all that because the data from, unfortunately, we live in a world where Western science or data is often used by investors to facilitate things like scale. So what we did is we gave 10 years of data from the program that I just described in Indonesian Borneo, again, the hospital and the jobs training. We gave 10 years of data from that program to researchers at Stanford University, and they analyzed the first 10 years of data from this first site. And their analysis culminated in a publication of our impact last year in a scientific journal called The Proceedings of the National Academy of Science. It's got a very boring title. Well, it's not too boring of a title. Improving rural healthcare reduces logging and conserves carbon in a tropical forest. But you see there in the title of that paper, the link between healthcare and conservation. And one thing I'll ask you later is, how many times has your doctor or physician talked to you about something to do with the ecosystem around you? And we can come back to that. Let me get back to the point. So these communities were right. And Stanford's analysis told us and showed us and validated for us that this radical listening approach does work. So here is a summary of what the researchers found with our data. Between 2007 and 2017, Health and Harmony made a $5.2 million investment in the community design solutions. And this resulted in some pretty remarkable things across, well, I'll just go ahead and say it, across the Sustainable Development Goals. And I don't want to bore you with that, but I'll come back to it, and I think it'll be clear what I mean. First, we achieved a 90% reduction in the number of households that were reliant on logging for their livelihood. Now, this reduction in logging averted the loss of $65 million worth of above ground carbon. Okay. Now that's very important because some of you might be aware of the emerging carbon market. You may have bought carbon offsets before COVID if you flew somewhere, but carbon is starting to become valued. And this is very important within the planetary health discussion. But when I say that our intervention protected or kept in the trees $65 million worth of carbon, that's something that's very important in our own advocacy. So furthermore, because of the reduction of logging, we saw 50,000 acres of secondary rainforest regrow. Now, this is important because clearly there are thousands, tens of thousands of species that live in these forests. The flagship species being the Bornean orangutan. Now, the Bornean orangutan is critically endangered, and 20% of the remaining population of this species lives in this forest. So their habitat is being protected and expanded. Now, from a human well-being point of view, what did we accomplish in that 10 years? Well, in the hospital's catchment area, okay, so remember we built a hospital, a 15-bed hospital, inpatient and outpatient. Now, a hospital's catchment area, that's just jargon, and that means all of the people that live in the geography that will go to this hospital, and that's about 120,000 people in our case. Now, in the hospital's catchment area, we saw a decrease in infant mortality of 67%. Okay, so 67% fewer neonates were dying during these 10 years compared to the rest of the country. Okay, so those outcomes are pretty important across human health, across human impoverishment, across rainforest protection and global heating and the climate crisis. Now, a very important sort of mentor for us said it best, I think, when she said that Health in Harmony's innovative model has clear global health implications. Health and climate can and should be addressed in unison and done in coordination with and respect for local communities. And I gave her a big hug because that really sums up everything. I wish I had said that. So this new model has clear global health implications. Well, what does that mean? Well, I described that global health practice, healthcare practice around the world for the last roughly a century has focused only on one species, us. But clearly, we need to think about our interdependence with nature, our relationship with planetary health and the climate, but also in coordination with and respect for local communities who are experts in solving the problems in their geographies. Okay, now that was our first site. So we as an organization then wanted to understand, could that model work as well in other countries, in other contexts? So we feel a real sense of urgency to the work that we're doing. And we believe that by unlocking community solutions and investing precisely in those solutions globally, it's possible to preserve and restore the roughly 1.8 billion hectares, which is about 4 billion acres, don't quote me on that, that are left on planet Earth. So that's 1.8 billion hectares, or roughly 4 billion acres of tropical rainforest left on planet Earth. We think we can, have a good shot at protecting the most important rainforest within that amount. And I didn't mention this at the top, but in the last 50 years, we've lost about half of the forests on the planet. Today, our interventions in 3 countries, beside rainforest communities, are helping to protect about 8.5 million hectares, which is about 18 million acres, plus or minus. So what did we do? We had the question, can it work in other rainforests? So we did what we call replication. We took our model to another community in Indonesian Borneo, to another community in Southeast Madagascar, which is off the eastern coast of Africa, and to work beside another community in the Xingu River Basin of the Brazilian Amazon. And we wanted to introduce this model, and for 3 or 4 years, do the same thing that we did back in the program I just described for you, to understand if this radical listening approach can be effective. Again, the community design solutions that we see from country to country to country are roughly the same. It's roughly access to human health, right? With jobs training, alternative livelihoods, and conservation. Okay, and I just want to say a little bit, this is a little bit pointy-headed and boring, but the radical listening methodology is not just something you do at the beginning of a program, right? It's something you do at the beginning, and then at many points along the way to troubleshoot and to improve. Okay, but all of the communities are designing roughly the same kind of system. Now, this is just a quick photo of the hospital that we established on the border of the rainforest in Indonesian Borneo. Okay, Bukit Raya. Very quickly, this is Dewi. She's a midwife on our team, on our healthcare team. Bukit Raya is another massive rainforest in Indonesian Borneo. And what did the communities design there? The communities concluded there that they could stop logging in the rainforest if they had access to improve maternal and infant, mother and child health, if they could experience improved maternal and infant mortality, because healthcare costs and time away from their crops is significant in these communities, and it's related to mother and child health. And they also concluded that they would need an agroforestry or a regenerative agriculture approach that would allow them to transition from logging. So that's exactly what we've done. And we started this program several years ago. The community in Southeast Madagascar, they concluded through the radical listening that, again, healthcare, mobile clinics. Madagascar is my favorite wonder of the world. The biodiversity on this island, 80% of it exists nowhere else on planet Earth, like lemurs, 105 species of lemurs. This island nation is the worst case study of what's coming. It is on the leading edge of the worst impacts of the climate crisis, right? Things like increased frequency and severity of cyclones, shrinking growing seasons, right? So food insecurity in Madagascar is as bad as it would be anywhere on the planet where there's not civil war. So again, communities concluded access to primary health care. So we implement mobile clinics in this very remote area, and rice agriculture training. So this is linked to food security. There are varieties of rice that take shorter time to grow and mature, and you get more harvests in a shorter amount of time. Now, they're not genetically modified, and conveniently, the experts in knowing how to grow that variety of rice live several hundred kilometers away to the north, right? So we're going to see a picture in just a few minutes of that training. Okay, so just very quickly, this is what a mobile clinic will look like in Madagascar. This gentleman on the right is a villager, and Romy on the left is one of our nurses on our medical team. This is what a training looks like in Madagascar. We've trained a couple of thousand community members now, 62% of them women, because I mean, I could say this globally, women are the backbone of the household. But if you've ever been to sub-Saharan Africa, you know what I mean. It's absolutely irrefutable that women are the backbones of the household. So that's why the majority of our trainees have been women, and it's why we want it to be that way. And again, I said skilled Malagasy were available up north, so we find them and we bring them down south, and they train on our behalf. Okay, the third replication site is in Brazil, the Xingu River Basin. This is a different context. So this is not about local communities being forced to extract from their rainforest because of impoverishment. This is a question of external pressures pushing out indigenous and traditional rainforest communities. So these external pressures, like low economic opportunity, but here we go again, access to healthcare, 9-10-hour boat rides to come out of these forests to get to the nearest medical clinic. Okay, the goal here is to keep these traditional and indigenous communities on their land, because they are the frontline defender of this forest. It's when they leave this land that cattle ranchers and agribusiness and other land grabbers steal their ancestral lands, right? So our goal here is to actually keep them on their land. And it's extraordinary. I'll show you a slide in a few minutes and we'll come back to this, but this land is very sparsely populated, and one family may protect, you know, a couple thousand or even thousands of acres of forest, but their very presence on the land is the key that we have to ensure in order to protect these forests. And again, healthcare, continued economic support, and education. And so that's the system that we're investing in the Xingu River Basin. So this is a picture of the Xingu River Basin from space in this circle. Now, inside that circle is the land area approximate to the or equivalent to the United Kingdom. This is massive rainforest, but this Xingu River Basin rainforest is different from other rainforests. Not all rainforest is created equally. This is sometimes referred to as the green shield. If scientists say if we lose this part of the Amazon rainforest, it could be game over, and it doesn't matter how the other important pieces of the rainforest, you know, whether they excel or not, whether they're cut down or they grow. So this Xingu River Basin, this green shield, this is the part of the Amazon where any of you that live on the West Coast, in the Pacific Northwest, California, Oregon, Washington, you know the change in the last 4, 5, 6 years in our dry periods and in the fire seasons, especially in California. Those hydrological cycles are in the atmosphere and are connected to the loss of this rainforest. So wildfires that we're experiencing from California to Siberia are linked back to the loss of this Amazonian rainforest. So this is really important. This is a really important part of the world. And it's really important that the expertise of these communities is honored, recognized, understood, and invested in so that they can work to prevent external entities from land grabbing and then clear cutting. Okay, here's what a health expedition. This is our medical team going up the river, going up the Xingu River. These communities are hours apart and very sparsely populated. Here's Dr. Erica Pellegrino, our Brazilian doctor, who is doing her thing at one of our mobile clinics in Brazil. Now, I just want to end very quickly on a couple of things. First off, scaling our impact. All that means is we want to share the knowledge and expertise and the learning that we're gaining with others. We want to give our model to as many people as possible. Radical listening to facilitate community design solutions, invest precisely in those solutions, commitment to the communities, stick with them, and see it through. It's working. So we want to scale. How do we do that? Well, we do a lot of advocacy and influence. So more and more, I'm vis-a-vis, we were just talking about this with Michelle, but I'm on Zoom talking to folks that are in the United Nations, within the World Health Organization, folks that are linked to the annual climate conference, which is called the COP. And this year it's the COP 26 in Glasgow, Scotland. My colleagues and I do a lot of writing. So on the far left, you can see two op-eds that we've authored in the past few months. Re-entering the Paris climate agreement is a must for the US, but it's no panacea. And we talk about a planetary health approach to Paris Agreement negotiations. In the Boston Globe, the best climate change solutions benefit humanity and nature, right? There's a lot of talk in investing in untested and like super expensive technologies to basically hoover carbon out of the sky. And I'm thinking, well, wait a second, we just need photosynthesis to do its thing, right? And photosynthesis is the way that plants convert sugar, oxygen, and water into sugar, carbon dioxide, and water into oxygen. So that photosynthesis is the process by which plants are absorbing carbon dioxide out of the atmosphere, are sequestering carbon dioxide. So we do a lot of advocacy. We try to influence others to think and act like us. And then the other thing we're doing to impact at scale is we're developing an online website, which imagine putting our model into a virtual space. Okay, imagine we train an army of listeners around the world. So you can come to a website and you can access the radical listening training as an e-learning module. Then you can be accredited by us. Then you can go to the communities. Maybe you live near them, maybe you don't. You can conduct radical listening exercises. You can facilitate the design and capture of the community's consensus-based solutions. And then you can upload for all the world to see onto a website what those communities need to live in balance with that rainforest ecosystem. And then if you work for the Nature Conservancy or the Gates Foundation or a local business, or you're just an individual who cares about planetary health, you can come to our website, you can understand what rainforest communities need, and maybe you have time, talent, or treasure that you can invest into a partnership to help them realize their solution. Now, our founder, Dr. Kennery Webb, my partner in crime, she is the visionary whose story is phenomenal. She has a TED Talk that's a few years old now. I can show you the link with the TED Talk, but her book is going to be published by Macmillan Flatiron later this year at the end of September. And the title of her first book is called Guardians of the Trees, a journey of hope through healing the planet. You know, models like ours exist. you hear nothing but, if you're like me, you get very frustrated with anything that comes out of big government, like the G7 or the UN meetings or congresses that the US government holds around climate. It's always insufficient, the actions they're ready to take, and they're always, humbly speaking, missing the point a little bit. Interdependence and interconnection is not featuring enough in their solutions. So Lily, you can have hope because there are organizations like Health and Harmony who are working very, very hard to influence governments and big, important actors to work in an interdependent planetary health way like we do. And Dr. Webb is really a pioneer in planetary health. I won't go into the story, but I won't go in for a long time. She was studying as a 20-year-old orangutans in Borneo, understood that if she didn't put humans at the center of the protection of the rainforest, there was not going to be a future. She put herself through med school and she started Health and Harmony, and she's the reason I'm here today. So that's the end of this presentation. If you would like to get involved with Health and Harmony, you can sign up for our e-news. You can go to any of these social media platforms. You can get our newsletter. I would invite you to continue educating yourself about planetary health. I'm happy to take any questions. And I just want to end by saying that, again, we are extraordinarily grateful for Tree Song, for Michelle, for what Tree Song offers us and our family and our children. If you do have it in your power, and if it's feasible economically, a donation to Tree Song or to your local nature school would be incredible, so that children can start at a very early age to identify species. Like, my kids are like little naturalists now walking around the forest, but also really appreciate concepts like planetary health. So with that, I'll be quiet, I'll hush, I'll stop sharing, and I'd be happy to answer any questions.
That was awesome. Thank you.
Thanks, Doug. I appreciate that.
Yeah, you
Not
know,
leaving yet.
I'm sorry, Doug.
Oh, sorry. I was just gonna say I'm gonna sit here and think for a good question. Go ahead.
I was just gonna say that, you know, watching all these global warming documentaries, and I watch them all. It's it's all sort of the same at the end, right? They are information about what is going on, but I was always wondering about, like, what's the next step? Like, what can we do to get more involved, and what are our options? Some of the documentaries provided some solutions, but there's not enough of this, what you just said, like how to get involved, like what on individual level people can do in these communities, and just recently I had discovered the what is it, the volunteering, how volunteering, and how I always felt really negative about, like, ministries, gosh, I'm like running out of vocabulary tonight for some reason, but
It's okay.
Groups of people going abroad in order to try help communities there, while they're spending so much money on flight tickets, and the expenses are so high. And I was really lucky because I got to travel around the world quite a bit. So I've been in Africa, I've been in countries that I've seen starving kids. I've seen it with my own eyes, and for me, intuitively understood that the solution was not for us, that could not really help in a major way in these undeveloped countries to buy these expensive tickets and go there and it's in some way help, because it was really not the help that these communities need. It was not the best way these communities can utilize our help. So this was really nice insight into what you guys do and what options there are.
Thank you. Thanks very much. I mean, I think you're exactly right. What can we do? I think there are many sort of movements or lifestyles that you can adopt. Veganism, zero waste, recycling, and on and on and on. I think those are extremely important. And especially those of us who live in Eastern Europe, Western Europe, Northern Europe, North America, we are creating the crisis, right? It's like our footprint is enormous compared to almost anyone in sub-Saharan Africa, for example. We need to digest that, right? We need to digest that. I think we need to understand. I would say continue educating yourself about planetary health. Understand, I think, that the health of that rainforest half a world away comes back to you, matters to you and your family, right? And we work with medical schools now in this country and in other countries to integrate this kind of thinking into the training that young physicians or, in med school. It's hard for me to sort of prescribe behaviors because I'm the guy who looks at the wooden straw or the refusal to give a straw, and I'm too quick to say that's a salve for that's an excuse, right? And at the same time, I think I've been fortunate enough to have these experiences, and I think if we can all take small bites in the right direction, not having the straws, zero waste birthday parties, don't fly, right? If you don't, those things really matter. And I'm sure there's somebody else on the call who can answer, what can we do question even better than I can.
Oh, yeah. But those are the basics, that we should have all been doing a long time ago. Or you described like what you are involved in, that's the next step. You guys are making a difference on a different level. We should have all been recycling a long time ago. We should have all been, if not vegans, at least eating organic, because
right,
that makes a big difference too. I mean, it's maddening because you still see that it's not integrated into our education, of kids. It's just
right.
really not.
That's troubling.
We're just so behind. So
yeah, that's troubling. I was speaking to a graduate from the University of Virginia a couple months ago, it doesn't matter when, and she graduated from the business school, and I went to school there, and she got in touch with me, and it came into the conversation. I said, wait a second. So you went to the business school at the University of Virginia and they never mentioned the climate crisis to you? The climate crisis is the number one threat to business, like, period. How could you leave that institution and no professor talk to you about risk management of, you know what I mean? I mean, the basics. So we do have an issue. We definitely have an issue. I didn't realize it was 8 o'clock. I just talked forever. I'm so sorry, guys.
No, it's been wonderful, Jonathan. I wanted to, Lori sent a message, but it came just to me, and I want to make sure you hear it. So she said, that was excellent learning about your logical solution, aiding the people so they don't need to destroy their habitat in order to survive. So I just wanted you to hear her
Lori.
feedback. Yeah,
Thank you.
yeah.
Thank you.
And thanks for being a part of Tree Song's classes. She's been to many. So yeah, that was wonderful. Thank you so much for the work you're doing in the world. I really deeply, from the bottom of my heart, I say that. And it was very eye-opening to me personally. So yeah.
Good. Well, thank you, everyone. I really appreciate the opportunity to be here. I know that I'm a little bit pointy-headed with things sometimes, so forgive me for that. But please, I can also, if anybody's interested, I can share with Michelle some resources on planetary health. It's easy to remember: Planetary Health Alliance. If you Google the Planetary Health Alliance, you will find loads of resources on the issue.
Wonderful.
Yeah.
Thank you, Jonathan. I expected to learn a lot, and I did.
Oh, great, Jane. Thank you so much for your kind words. I really appreciate you being here.
Yeah, thank you.
Jonathan, oh, sorry. I just wanted to ask one follow-up question before we conclude.
Please.
And I'm sure I'll find out a little bit more about this when I go to your social media sites. But one thing that I've recognized, and maybe a lot of you have too, over the past year, is how important social media is, and also detrimental, but how important it is in getting a lot of information out there for people to learn. So is there anything, aside from just like an Instagram post, but like maybe like a short video or something that's easy and digestible that I can pass around to people in my circle?
You bet. You bet. You mean on Health and Harmony and the way that we work, or do you mean on Planetary Health?
Health and Harmony, but yeah, anything you can give me is awesome.
Okay, what I would do is if you go to our website and we've got right at the top of our website, it says watch our film. We have a couple of profile films. And let me, if you've got a minute, let me put the Kinnery TED Talk in the chat for you.
Oh, that'd be great.
Yeah, it's dated now. But that's okay because you'll where do I stop that? Okay, let me just put this in the chat. Okay, so that should be Kinnery's 2015 or 16 TED Talk. Her book is set to come out, and hopefully we'll do another TED Talk early next year. But yeah, thanks so much. And on our website, and on our I gave a talk last week for the World Health Organization. That's a pretty neat, it was a webinar on preventing pandemics, which is something that we're heavily involved in. But there you'll find a lot of stuff on the press page of our website as well.
That's perfect. Thank you so much. This was very refreshing. Really appreciate it.
Yeah.
Well, thank you all. I really appreciate you guys.
Yeah. Thank you all for being here. And again, Jonathan, much gratitude to you.
Right back at you, Michelle.
Yeah.
Thank you so much. We love Tree Song. And if every kid could have a tree song, you wouldn't need me doing this kind of thing.
Wouldn't that be a beautiful thing? Yeah. Well, I'm blessed to be a part of such a thing. So
yeah,
it's good stuff. All right. Well, is there anything else from anyone, or should we bid you all adieu? Hope to see you at another class sometime. Take very good care, everyone.
Thanks, everyone.
Yeah.
Thanks, guys.
Thank
Cheers.
you.
Bye.
Good night.
Take
Bye-bye.
good care. Bye-bye.
Bye-bye.